I'm Michael Kotrba, consultant orthopaedic and trauma surgeon. I'm working at the Croydon University Hospital, and I've been there for 13 years. I've previously been consulting in Germany, in the beautiful town of Lübeck. Well, kyphoplasty is a minimally invasive procedure. It is used for osteoporotic vertebral fractures, and with the nice guidelines state very clearly that basically it is the gold standard for osteoporotic vertebral collapse. And what you basically do is you try and restore the height, because any vertebral body fracture leads to a kyphotic posture, and you don't want to do that, because every time you fracture a vertebral body, your center of gravity will move anteriorly by about 8 degrees. And you want to try and restore the height so you don't overload the anterior column of the spine, which then leads to further fracturing. And the likelihood of getting another fracture after the first one, it already becomes threefold, and after 2 fractures, tenfold. So you want to try and keep the center of gravity in your spine, basically. So that's when you do balloon kyphoplasty, by minimally invasively inserting 2 working cannulae, 2 balloons into the vertebral body under II guidance, which is X-ray guidance. And you blow up the balloons to lift the fracture, remove the balloons, and you put a special cement into the vertebral bodies, which stabilize the body instantly. Patients can move very quickly after that. I've been involved with it since 2001, so for the past 16 years, and I've been teaching it nationally and internationally for the past 10 years, so to other surgeons from around the world, so this procedure can be used worldwide. Right, well, you position the patient, comes into hospital, and when he comes to theater, my anaesthetist does the general anesthetic. It's best to do it under general anesthetic also, although in other circumstances, as an exception, it can be done under local, but it's much more pleasant for the patient just to have a general anesthetic. And then the patient is positioned in a certain way. I would just say the normal words, on his tummy while he's asleep, and from the back I do 2 minute stab incisions for one vertebral body. Insert the cannulas under X-ray guidance, and we always take a biopsy to make sure that we're not missing any other pathology. And the balloons are inserted, they are expanded, and under X-ray vision you can see if the fracture is fresh, how the balloons restore the height of the vertebral body. Then I remove the balloons and I put the cement in there to stabilize it, which stabilizes instantly. And you only need steri strips for the skin, and patients, usually most of the patients, can go home the same day. It's a day case procedure, and those who stay overnight are due to the fact that the anaesthetist wants them to stay overnight. Either they're more than 80 years old, or they have other comorbidities, we call it, other illnesses, which he would like to observe overnight. Well, any form of risk factors for any form of surgery are embolism, DVT, infection, nerve damage, risk of cement leakage, which could lead to cement leaking into the canal. There's a very certain technique with balloon kyphoplasty, because it is a very safe procedure. If you're well trained and if you're properly trained, it is a very safe procedure. And thank God, since 2001, in the 16 years, we didn't have any of these complications. And I don't want to start them either. Well, I mean, they can basically do anything after surgery, anything they've been doing before they had a fracture. They can drive a car. It depends on how much pathology they have in the remaining spine. I mean, this is not a miracle cure. The only thing it will cure is the fracture and the pain from the vertebral body fracture itself. So, and we know that we have national and we have international studies worldwide where we know that the pain drastically decreases and stays that for years. But of course, if you have a lot of degenerations in the other parts of the spine, or the fracture was there for quite a long time, they can still get discomfort from the stab incisions and from the posture itself. That's why it's so important to have good physiotherapy or osteopath input, depending on what is required for each patient.
Hi, I'm Tim Allardyce. I'm the Clinical Director of Surrey Physio and Croydon Physio. I'm a physiotherapist and osteopath, and one of the areas that I work with Michael Kotrba is on kyphoplasties and the rehabilitation following kyphoplasty. I think the first thing that is important to mention is that when we see patients for rehabilitation, it is sometimes expected that you are in pain after the surgery, so you can be quite sore. So don't be alarmed if the initial pain response does feel heightened, and that usually settles and everything is fine. And the second thing to be aware of is that sometimes you can get pain at the bottom of your spine, which is nothing to do with the kyphoplasty. And that leads me on to one of the ways that we use rehabilitation. We actually use it to improve posture. So we want to improve your posture, make you more upright, get you to stand up straighter, sit straighter, and that will prevent too much forward bending of your back. And the second thing we tend to do with rehabilitation is to get your range of movement improved. So we want to stretch up your spine, improve your range of movement, and get those muscles working really well. That will help stabilise your body and improve mobility, which will help your spine function better and put less strain through certain areas of your back. We can also help with reducing any inflammation, and we might use techniques such as electrotherapy or acupuncture, which can help. But essentially we use an exercise rehabilitation program, which I will guide you through shortly.